Today we're going to be talking about volume augmentation of the pre-gel sulcus. We're going to be utilizing a product called Voluma in a lady who has had previous facelift and continues to have pre-gel sulcus. We typically initiate with 1 cc syringe and 30 gauge needle, giving a local injection to the infraorbital nerve as well as the access point. A 27 gauge needle will be utilized to create access for our cannula. We typically utilize a 1.5 inch 25 gauge cannula system to inject the product into the pre-gel sulcus. As you can see, we inject in a retrograde fashion in microaliquots along the marionette folds and pre-gel sulcus. The product is placed in multiple layers, deep to the muscles, as well as in a deep subcutaneous tissue. As you can see, the area is massaged and you have very little irritation of the area. Another key aspect of the pre-gel sulcus is actually what we call an infrajowl region, where just deep to the mandible region has a depression that needs to be injected. And this is, again, secondary most likely to bony resorption of the mandible as occurs in the aging process. In this patient, as you can see, the jawline is evened out on the right side with improvement of the infrajowl region. The marionette folds are now injected slightly more to continue creating an even contour. We now turn our attention to the left side where an exact same procedure is undertaken, and you can see the injection all the way to the marionette folds around the oral commissure, making sure to stay inferior to the fold so we do not exaggerate and increase the marionette folds. And again, the injection is done in a retrograde fashion. As you could see in this area, the infrajowl region is injected, which creates a nicer and smoother jawline. Symmetry is created by rechecking the patient and going back and forth between the two sides to create an improvement that is symmetrical and bilateral. Here you can see the before and afters, approximately 4 weeks after the procedure. That shows an improvement in the area and an aesthetic improvement in the jawline.